Hello, South Vermont Hospital, Nurse Kelly speaking.
Hello, this is Dr. Awesome speaking. I have the new orders for your new patient, Shandane Holad, who has been recently diagnosed with type 1 diabetes. I have the sliding scale and the orders that I will fax over as soon as I can.
Okay, Dr. Awesome, I will look out for the fax and give it to my med nurse. That's the call light in room 143.
Excuse me, are you Nurse Barbie?
Yes, that's me.
Hi, my name is Chica. I'm here to follow you today.
Okay, perfect. Well, the first thing I do in the morning are my glucose checks. I had 3 patients, 1 died, and the other one got discharged. I also just got today a newly diagnosed diabetic. So, do you know how to do glucose checks?
We practice in class only, but I can help you today.
Okay, perfect. Then we'll head on over to Ms. Ola's blood glucose. We'll go ahead and write it down in our MAR. So what we... Hi, Ms. Ola. How are you? Don't worry about her. She's always like that. She has Alzheimer's.
Oh, okay.
So we'll go ahead and initial on the date that we did it. We write down exactly what her blood glucose amount was. And here, we would write down how many units of insulin we gave her and where. But since she didn't require any, we'll just go ahead and put zeros on there. So the next patient we have is Ms. Holan. She's newly diagnosed with diabetes, so I'm not sure how she's going to react to all of this. So we'll go ahead, gather everything up, and hope for the best. Okay?
Okay, Nurse Barbie.
Good morning, Ms. Shanini. How are you today?
I'm Ai.
Hi, Ray Ray. That's not her name. My baby's name is Shandane Holad.
Tell him, baby.
Excuse us, Miss Shanini. Alright, Miss Shanini. We're here to check your blood glucose. This is going to be part of your new daily morning routine with me.
How are you going to do that?
We're going to have to do a little finger stick with our lancet here, and Miss Chica is the student who's going to be helping me with that.
Does she know how to do it?
Yes, she does. I seen her this morning, and she is fabulous.
Does it hurt?
I'm not going to lie, it does hurt a little bit.
I don't believe in needles. It's against my religion.
Sorry, Miss Shanini, but this is one of the only ways we can do it.
No, I don't think so.
It won't take that long, I promise. It'll be really quick, done and out of here.
Baby, tell him I don't want to do it.
You can hold my hand, baby.
Okay.
Okay? So can Miss Chica do it for you today?
I guess.
Alright.
But I don't like needles, though.
It's okay. You don't even have to look at it, okay?
Mm-hmm.
Go ahead. Okay, Miss Solange. Is there a finger you prefer?
Yes.
The middle one or the other one doesn't hurt as much, so. It's okay, Miss Shanini.
Does that hurt? What is that?
It's just the alcohol. To clean your fingers.
Why you gotta hold it so tight?
Just relax.
Oh, you're hurting me!
Miss Shanini, I'll hold your hand, okay? I promise I won't hold it so tight, okay? Just go ahead. Raymond, what did you do with him the other day? Was he here the other day?
No, he was with...
I got you, baby. Don't worry about it.
It's okay. It's okay. Did you... Go ahead, wipe the first one.
Oh, you're hurting me!
Miss Shanini. It's okay. It's okay. You're fine. You're fine. The worst part of it is all done.
I can't deal with these needles. Gotta get these people to stop poking me.
Alrighty, so now that we got Miss Shanini's blood glucose, we're going to go ahead and write it in. So hers was 178. So write in 178. And with her sliding scale, 151 to 200 gets 2 units. So 178, I'm sorry, is in between there. So we'll give 2 units. So we'll go ahead, where it says units given, 2 units. And her order is for Humulin R. I think that's another one. Humulin R. Humulin R. Okay. Now we always want to do 3 checks with our insulin. So we want to make sure that as we get it out of our med cart, we check our insulin. We also want to make sure that we check it against our MAR. So Humulin R. And then also, once again, when we put it away. Okay, perfect. Now, hers is BID, which is, do you know what BID stands for?
Twice a day.
Perfect. So hers is given at 6:30 in the morning and also at 16:30. So I'll go ahead and show you this. Right? Okay. And we'll take our alcohol pad, and just with one big stroke, we are going to take our vial, just one time, one circular motion, all the way around. You want to rub it kind of with a little bit of force, because we want that friction to kill any type of bacteria that might be on there. Okay. Now this is our insulin syringe. Do you know how insulin is measured?
In units?
That's right, perfect, units. So this syringe that I have here, you want to check a look, is 100 units. So it goes by twos. Okay. And for this one, our gauge is 29, which is very, very tiny. So I'll go ahead. Very little. Okay. Give it a little room. Okay, now that we cleaned it, we'll go ahead and make sure that we aspirate a little bit, and we want, how many units are we giving Ms. Holan?
2 units.
2 units. So we want to make sure that we put 2 units of air in there. 2 units? Okay. So I'll go ahead and stick our syringe into our vial and inject those 2 units of air. Okay. Go ahead and I'll bring it up. And you want to do this slowly because you do not want any type of air bubbles in here. So we'll go ahead and inject 2 units of our Humulin. Now with insulin, it's a 2-nurse check. So what that means is there's always going to be 2 nurses that checks this before we administer it to our patients. Okay. So I'm going to go ahead and call Nurse Kelly. Nurse Kelly! Nurse Kelly? There you are.
Yes, Miss Barbie.
This is for Ms. Holan, the one who was newly diagnosed. I just need you to double check for me the units on there.
Okay, perfect.
Thank you, ma'am. Okay. So 2 units. Okay. Something that is very, very important is you never ever want to recap your needle by hand. So the easiest thing that I do is I take my cap and I put it against my glove box or whatever else that I might have sturdy on here. I put the needle, the little needle cap against it, and I fish for it. Very, very important. You never want to get stuck by a needle. There you go. And that's it. So we'll go ahead and put that in there. And we'll get our new alcohol swab and some gauze so we can go ahead and clean our patient. Now, for this, we always give it sub-Q. And there's a couple different areas that we do that in. We usually do it in the abdomen, at least 1 inch away from the umbilicus. We also do it in the upper thighs, and also sometimes behind the arms. Why we rotate our sites on our patient is just to prevent bruising and also just to keep the integrity of their skin. We don't want to keep continuously doing it in one spot and have a potential of building up any type of maybe scar tissue. Makes it hard or make it harder for us to get the insulin injected into the body properly and absorbed properly as well. So we'll go ahead, and I got extra gauze and our alcohol patch. We have our needle syringe already filled, so I'll go ahead and get some new gloves, wash my hands, and then we'll go ahead and head over to Ms. Holan's room. And one thing that is really important, since you're here, you can help me out, is please distract her. You saw how she was when we did our finger stick this morning, so I don't know how this is going to go. So just try to talk to her, hold her hand, while I explain everything to her about the shot and where we're going to give it to. Okay? Okay. So let's go ahead and head on over there. Make sure we close our MAR, so none of our patient information. I'm afraid of needle. It's okay, Miss Holan. Get your ears, Miss Holan. Oh. So Ray bought it for me. And we'll always put it at a 45-degree angle. Make sure the bevel is up. Very important. Make sure it's up, okay? We don't want to hurt our patients any more than we have to. No. How about yourself? Where did you get it? Oh, I got it for my anniversary. Oh. There we go, Miss Holan. We are all done. That is it. Is there any more needles for today? That is it. We always want to make sure we discard our needles, and the biohazard, never want to recap them. So we'll go ahead and throw that in here. Miss Helen, we are all done, sweeties. That's it. That's awesome. That's it. Okay.
All right.
So we'll see you in a little bit. Probably Ray Ray will be here soon. Alrighty? Okay, so now we'll just go back and we'll document everything. And we gotta make sure we sign and make sure Nurse Kelly signs everything. Alright, Miss Helen.
Well,
Thank you.
Goodbye.
Alrighty, we'll see you later, Miss Helen.
Bye-bye.